Okay, hi Mr. Tar, how are you doing today?
I'm doing well.
My name is Ray. I'm a student physical therapist. Do I have a consent to work with you?
Of course, yes.
So tell me about yourself. Why are you here today?
So yeah, I've just been having kind of like on and off again pain in my like posterior hip area, the back of my hip. And I would even explain it as almost lower back pain too. I've been looking into it, and maybe I'm thinking my SI joint. And it's mostly on my right side, but it does feel like it kind of goes back and forth between the side. But most of the time it's my right. And yeah, I don't know, it's my hip or my lower back area, but definitely it's been going on for a while.
So for a while, could you specify how long does it go?
Yeah, so it's been on and off for probably 2 years now. Like right when the pandemic actually started, I can remember that's when it happened. So when it started. So
Okay, so around those 2 years, how has it changed since like the beginning of the feeling?
So I can vividly remember working out one day, and basically I was doing a cable row, a seated cable row, and I think I had just agitated it because in the past my lower back would get tight and I would just stop whatever I was doing and it would feel better. But I could tell this time was different because the next day when I woke up, it was just in a lot of pain. And that's what I had done at the gym, where I just stopped lifting, and I still was early in my workout, so I decided to go on a jog right after. And then the next day, it was just like a pain I've never felt. And since then, it's just been very on and off. It's never felt that extreme as that day after, but I definitely notice it kind of tighten up if I lift weights, specifically lower body movements. If I do anything like jogging or basketball, I feel it kind of flare up. Yeah.
So 0 is like no pain at all, and 10 is super painful. What's the like pain level you feel when that happened and right now?
Yeah, so the day after, it was probably like a 7 out of 10. Very noticeable. Definitely something was wrong. It wasn't the typical, just my back was tight like I was used to. And now, at the worst, maybe a 4, and that's probably at its worst. But it's more or less like even if sometimes I'm sitting for a long period of time, I can just feel like this tight something. I can just tell it's there. It's always on my mind. I can just tell if something's there.
So like you said, how does it change throughout the day? Like, do you do something to get it better or worse?
Sometimes I try to stretch, maybe I read about this muscle called the QL. I'll try to stretch that, and I think maybe it helps, but probably not. But there's really no pattern. It just really depends on the day. Like I said, with a lot of activity that's not very symmetrical, so like one leg stuff or basketball, things like that, it kind of flares up. But usually, even lately, if I'm doing legs, squats, deadlifts, and it's like a movement that I can anticipate, I really don't feel much pain. But it's very random. I wouldn't say in the morning it hurts more than at night or in the middle of the day. It just kind of comes and goes all the time.
So, speaking about this, does it happen like usually once per week, or do you have a general timeline for that?
Probably like 4 or 5 times a week.
4 or 5 times.
Or I would say 4 or 5 days a week. I noticed the symptoms of just some type of tightness kind of fluctuating throughout the day, and it's not debilitating or anything. You know, it doesn't disrupt my activity level or life, but I definitely just notice it. Yeah.
So, do you have any like past surgical history or any chronic issue?
No. Never broken a bone. Never got surgery. Nothing.
Any medication you're taking right now?
No.
So, tell me more about like how do you live?
How I live. So I live in an apartment with my girlfriend. It is on the 6th floor, but we have an elevator, thankfully.
Do you have like stairs?
No stairs or steps in my apartment. Yeah.
And what's your like occupation generally?
So I'm a graduate student, so I'm sitting a lot.
Good job.
And I'm also a personal trainer. So I'm on my feet a lot, fairly
Cool.
active.
So, what's your goal in general?
My goal in general is just to get back to playing basketball without pain, and just generally just to stop feeling the little bit of tightness that I feel. It would be ideal not to have to feel it. I think I could live the rest of my life feeling how I've been feeling. Like I said, it's not debilitating, but I would certainly really like not having it going on.
Okay, so about your daily activity, do you feel any disturbance or discomfort, or you're generally good?
Like I said, usually during activities when I'll start to feel it, and I've gotten good at trying to do like specific warm-ups and engage my core more. But the movements specifically are when I kind of flex at my spine forward, and even when I kind of extend at my spine. I kind of feel it in both of those motions. Some days more than others, one or the other, but generally, like even as I sit here right now, if I just kind of move my hips around and my back around, I kind of feel that tightness up there, down there.
Okay.
Up, down there, yeah.
So I might still ask this, but do you feel like any discomfort when going to a bathroom, something like that?
No, I haven't experienced any issues with that.
Okay. If you have any questions, concerns, or anything you want to tell me, please do so.
No, I
Okay.
can't think of any off the top of my head. Thank you.
We're good. Thank you for coming today.
Of course.